Hello all the viewers. In this video, we are going to discuss about what is hernia, what are the types of hernia, what happens if hernia is not treated at the right time, what are all the treatment options available for hernia, can hernia be treated through medicines or through any procedure, or does it require a mandatory surgery, and what are all the available options in surgery, what is the difference between an open hernia surgery and a laparoscopic hernia surgery. So let's dive into the topic. So let's start with inguinal hernia. So what we can see in this picture is the red color here. What we can see is the muscle, and this is the pubic bone, and just above the pubic bone means the waist bone, we can see a small gap in the muscle through which the intestine is coming out. So let's dive into this and discuss in detail why an inguinal hernia happens. So what we can see in this picture is this is the muscle, and this all the intestines are being covered by this muscle, and here we can see the scrotum in which testis is lying. Generally what happens during childhood is the testis which is right now lying in the scrotum doesn't lie in the scrotum when we are in the mother's womb. When we are in the mother's womb, the testis somewhere lies close to the kidney in the abdomen. Then why this testis has to descend down into the scrotum? This can be explained because this is completely physiological, which is normal, and if it doesn't descend into the scrotum, then only it is abnormal. Why the testis has to descend into the scrotum is because of few things. For the testis to produce a good quality sperms, the testis temperature has to be low. So if the testis lies somewhere in the abdomen, it is covered by multiple layers of tissues and skin, so the temperature inside the testis will be very high. So to prevent that from happening, the testis which are lying somewhere in the abdomen slowly tries to descend through the gap in the muscle, and it descends to the scrotum. This is what generally happens in normally. So the path through which this testis has descended remains closed until the abdominal pressure increases later in the future. With increase of pressure, the hole which has already been closed slowly increasing size increases to large enough size so that through this hole the intestine starts coming out. So if this is the normal thing, and if there is any gap in the muscle, the intestine is trying to descend into the scrotum towards the scrotum. So that's why in most of the people, they can see in initial stages of inguinal hernia, they can see a gap or bulge over the groin region first, and slowly they can notice as age progresses or the duration with which they have the hernia increases, they can see slowly that the swelling has initially just limited itself to groin, but slowly as the hernia is progressing, the intestine is descending to reach up to the level of scrotum or testis. This is kind of advanced stages of hernia.